To start the session, before I would just like to introduce about the hospital, what we are into, what is our services and all. So Chennai Urology and Robotic Institute is a super specialty hospital dedicated to the treatment of renal diseases, offering the very best inpatient care in urology, nephrology, and uro-oncology. So we are equipped with emergency robot, four state-of-art operation theaters, ICU, chemo ward, daycare unit, dialysis ward, and CT scan. With the latest in diagnostic and treatment technology, and headed by one of the India's senior-most and respected urologist, Dr. P.B.Sivaraman, and leading expert in robotic surgery, Dr. S. Ananthakrishnan Sivaraman. So Curie is a premier institute for the renal diseases. So today, I would like to introduce our speaker of the day, Dr. P.B.Sivaraman, chairman and consultant urologist in the Curie Hospital. He is a distinguished and well-known urologist, and as the professor and head of department at Madras Medical College, he has left behind a legacy of urologists trained by him, who are leaders in their field of work across the country. Dr. P.B.Sivaraman completed his basic and higher medical education and his specialization in MCH, surgical urology at Madras Medical College, Chennai. He further completed his fellowship at Royal College of Surgeons at Edinburgh. He has worked for 5 years in higher training at various urology department centers in UK. He was also the consultant urologist at King Khalid Hospital in Saudi Arabia. He has had training in cadaver kidney transplantation at the Medical Center and Transplant Laboratory and Polish Academy of Sciences, Warsaw, Poland. Dr. P.B.Sivaraman is one of the most experienced and respected senior urologists in the country. He is one of the first surgeons to perform cadaver kidney transplantation in a government institution in India. He is credited with nearly 2,000 successful kidney transplants. He holds several awards under his hat. He is credited with nearly 2,000 successful kidney transplants and an appreciation of yeoman service to poor patients. He has been awarded the Lifetime Achievement Award by Rotary Club of India, Chennai. He has been honored with the Doctor of Science by India Medical University, Chennai. In recognizing his contributions as a urology teacher, his students and assistant professors have instituted an endowment oration in his honor in the Urological Society of India. In appreciation of his services to urology and teaching skills, the Urology Society of India, Tamil Nadu and Pondicherry awarded him Urology Gold Medal. He has served as the president of premier professional bodies in urology in India, such as Tamil Nadu, Pondicherry Urological Society, and Madras Urological Society. He is also the founder member of Cancer of Prostate Endeavors, called as COPE, an organization involved in research and creating awareness of prostate cancer. He is a life member of the Urological Society of India. He also has full registration with the General Medical Council of the UK. He is also a member of Indian Society of Organ Transplantation, a scholar, Indian National Science Academy, and a member of the Eurosphere. So, over to you now.
Good afternoon, everybody. Can you hear me? Just show your hand that you can hear me. Can't see your hand. Okay. Right, today we will talk about prostate diseases in men, because this month is a prostate awareness month, September. So, benign prostatic hyperplasia means there is an enlargement of prostate. The prostate gland is available only for men. A small gland which is below the bladder, on the way through which the urine also passes. It is the size of a walnut and it is about 7 to 16 grams. Helps to control the urine flow and produces a fluid component for the semen, which is when it is ejaculated, the sperms can swim in the fluid, and produces also a prostate specific antigen. These are all the work of a prostate gland, but the problems of prostate glands are very many. So this is the prostate gland, can you see? And this is the bladder. Through this only the urine passes through the penis. So if there is any problem with the prostate gland, the urinary problem will also arise. So if the prostate is normal, the urine will flow very easily. Suppose if the prostate is enlarged like this, it narrows the urinary passage, so the urine is left behind. So residual urine will be more visible. This is called benign prostatic hyperplasia. Benign means non-malignant. It is not a disease. Actually, it is part of a natural aging process of man. Normal graying of hair, eyesight difficulty, walking stick, all those things are hallmarks of aging of man. So this is also a natural aging process. This is due to the hormonal imbalance between the estrogen and the testosterone, which happens above the age of 45. So the enlargement can be benign, that means non-cancerous, or it can be due to cancer of the prostate. What are all the common symptoms of this prostate gland? When it enlarges, the patient's stream of urine is weak. It falls in between the 2 feet itself. It doesn't go outside the body. Next is, they frequently pass urine because there is some urine is left behind and they have to quickly pass again within an hour or 2 hours. Third is dribbling after urination. After you complete the urination, some drops will come for some more time than normal. This is also due to the prostatic enlargement. And when you want to go to the toilet, it will be very urgent. Even before you reach the toilet, you may spoil your undergarment. That is called urge to urinate and urge incontinence. This is also due to prostatic enlargement. So when these symptoms come, you should think that it is not just an age, but it is because of prostatic enlargement. And the leakage of urine. Suppose if the prostatic enlargement is very big, then the entire urine is not evacuated, then the bladder becomes full. And when it is overfull, it only overflows in drops. That is where we get the leakage of urine. And then frequent urination during night. Normally itself, people pass about 2 times because after the age of 50, urine production itself is more in the night and less in the daytime. So passing 2 times is not a great disease. But more than that, it means that you have a prostatic enlargement. These are all the common symptoms of prostate gland. So when you have these symptoms, when do you treat the symptoms? See, normally benign prostatic hyperplasia is needed to treat only when the symptoms are severe enough to bother the patient and affect the quality of life. Suppose there is a frequency of urination, the person is not going to the office. If you go to the office, every 10 minutes he has to go to the loo, means that it spoils the quality of life for the person. At the same time, in the night, if he gets up 7 to 8 times, it spoils his sleep. So that's also its quality of life issue. These are all things when you should treat the prostate. Next is renal insufficiency. If you leave the prostatic enlargement for a long time, then what happens? It becomes it obstructs the kidney from discharging the urine into the bladder. So it becomes renal failure. That is also a reason why we should go on interfere with the prostatic hypertrophy and treat them. Another thing is recurrent urinary tract infection. If you get urinary tract infection frequently because of the prostate, then also we should treat the prostate. So what causes the symptom? Prostate grows with the age and the pressure in the urethra restricts the flow. That is only causing the symptoms. So the first line of defense against bothersome urinary symptoms is there are only medication. You don't need to have an operation. 70 to 80% of prostate enlargement people do not require any surgery. That is the important thing to note. They can be always managed by the medication. There are two major types of medication. One is alpha-1 blocker, another is 5-alpha reductase inhibitor. These two medicines can be used in combination also. The first one is relaxes the prostatic muscles and makes the urethral opening bigger so that the patient passes urine better than before. The second one is called finasteride or dutasteride. It shrinks the prostate gland. So the two types can be combined together also can be given. So one is just watchful waiting. Suppose if the person says, I pass more urine in the night, just you give him some advice regarding water intake and reduction of coffee or tea and avoiding water after 7 p.m. so that the night they will not be disturbed so much. So this is called watchful waiting. We can just give them advice. Next is medications. So medications, I told you the two types of medication. The third is we can do some office therapies. The fourth is surgery. So first we will do about the watchful waiting and also the treatment, how this medicine works. As I told you, this is the prostate. So the urethra is, can you see, this is the urethra and slowly it is expanding due to the effect of these tablets. See, then the urine can pass easily. So it is without surgery. Another is the prostate size itself which get reduced. See, it is shrinking. If you combine both the things, the size also will shrink. The urinary passage also will be enlarged. So the patient will start passing urine better. So this is called medical management. So 80% of the people require only this. They don't require any surgery. The other part, which is 20%, will require surgery. It is called transurethral resection of prostate. So this is called, you pass an instrument through the urinary passage and resect the prostate from inside and make it bigger. This is another video you can see. So not necessary that what I'm trying to impress is not necessary that everybody who has got a prostatic hypertrophy will require an operation. So when you do the operation, this is called cystoscopy. You can see this is where we pass the instrument. This is the prostate area. Prostate is like that near the bladder and we enter the bladder. This is called bladder. Cystoscopy shows the bladder neck is obstructed by the prostate. Can you see that swelling is completely obstructing this area? What we do is with electrocautery, we resect that from the inside itself. And if there is any bleeding, we will cauterize the bleeding through the scope itself. So previously they used to open the abdomen and then remove the prostate. Now the recent technologies are we can do it through the urinary passage itself using electrocautery or using a laser. Both the things are available. We do it routinely now. It is the last 30 years they are doing only this transurethral resection of prostate. This is the standard, gold standard operation for the prostatic hypertrophy, which cannot be managed by medicines. So after the operation, the prostate would look like that. Can you see the picture above? See, this picture is full prostate. This is half the prostate resected, and this is entire thing is resected. So we resect, there is a big gap here so that the urine will pass very clearly through this. Can you see? This will be like this after the operation. Before the operation, this will be like this. This will be like this. Prostate obstructing the entire urinary passage. You can't see the bladder. Now after the operation, it will be like this, so that the patient will pass urine freely. This is for the operation. And laser is next step, same operation done by laser. Can you see the first picture is full prostate, second picture is half the prostate is taken, next full is taken. This is done by laser fibers. So these are also transurethral only. There is no cutting or stitching in these operations. So removal of the obstructing gland with the outer layer intact called suprapubic, retropubic, laparoscopic, robotic surgery. These are all done through the abdomen. Okay. What I described before, these two were done through the urinary passage itself. There are other types of therapies like microwave therapy, needle ablation, which is not very commonly used, but they are also available. And the Urolift, there is some stents also they are using. When the patients are not very fit for undergoing operation by anesthesia, they will do this. So next we will talk about prostate cancer. This is the picture shows cancer in the area of the prostate. And you see this picture, grade 1, this is little bigger, this is more bigger, this goes outside the, so according to the stage 1, 2, 3, 4, all the stages are depicted here. So prostate cancer is diagnosed by normal prostate symptoms as well as the rectal examination, where the surgeon feeds the prostate through the rectum, which is very hard. If it was very hard, that means he is suspecting cancer prostate. Then he does a biochemical testing called PSA. As I told you before, the prostate specific antigen is secreted by the prostate gland. In case of malignancy or cancer prostate, the prostate specific antigen will increase in number. Normally it is 0 to 4 nanograms, but it will go above 4, up to 200, 300 it can go. That means the patient is suffering from cancer. So when we suspect that he is suffering from cancer, we have to do some investigation like MRI to find out where all the prostatic malignancy is occurring. According to that, we will have to do a biopsy. And then we have to prove that there is a cancer prostate. Once we prove the cancer prostate, according to the stage of the prostate cancer, we will have to plan our treatment. So, if it is, the first slide shows, if it is a localized cancer, only active surveillance is enough. Just watch the patient, periodically do the PSA, and give his medications. Next is surgery for the localized cancer. That means you can do it with open surgery, laparoscopic surgery, and robotic surgery. Robotic surgery is the latest and the most accurate and most bloodless and simple operation, which is done in some advanced urology center. Third is radiotherapy. If the patient is not willing or fit for any operation, we can give radiotherapy to kill the cancer prostate cells. Fourth is hormone therapy, which is done only for people who are not fit for operation, or if the prostate cancer has spread beyond the prostate gland and gone to the pelvic organ. That means local operation or radiotherapy will not help him to cure. So we give him hormone therapy, because if you give anti-testosterone hormones, then the prostate cancer production of increasing in size will be reduced. So that is the principle behind hormone therapy. Even if this is not enough, it is a systemic spread, we have to give chemotherapy. So there are all the medications available. 10 years ago, there were only few medicines for cancer prostate. Now it has come to 13, 14 medicines. So we can have a good, reasonably good life even after diagnosing an advanced cancer prostate, which has spread to the bones and other things. So this is one of the major advances in prostatic cancer, the robotic surgery. As you can see, this is a robo in the first step. This goes into the patient. One assistant will hold all the other instruments, whereas the surgeon sits in a console. Can you see in the console? That from there he can operate this. This is the picture which shows the inside of the body. This is the prostate gland. Can you see? This is the robotic arms which are operated by the surgeon, which is sitting outside. And you will have only 3-4 holes of 1 centimeter in there. After that, it will heal so easily. You won't even know that it has been operated. But the patient can have walking to the toilet the next day itself, and there is no need of large recovery time, and there is no blood loss at all. And it is very, very clear margins can be done because the demonstration is 3D and it is very enlarged. So robotic surgery is the latest. It is done in our CuriHospita also, and also other centers in various places in India. So prostate cancer screening. What we are suggesting is never be afraid of cancer. Be afraid of not detecting it early. If you detect any cancer, not only prostate cancer, any cancer early, then you can have a reasonable chance of curing it completely. So we only miss by not detecting it early. So the awareness is most important. That is the reason for this talk also. Any cancer case which is diagnosed very, very early, it can be totally cured. So PSA screening test above 55 years of age, along with the master health checkup for other organs in the body, also include a PSA test. This PSA raises in cancer prostate and infection. Then once you see the PSA raised, you have to do a biopsy and then reconfirm or say that there is no cancer. PSA screening should be done at 45 years itself when the patient's family has somebody cancer prostate. Suppose his father, brother is having cancer prostate, then you have to screen the family, male members, at the age of 45 years because they are more prone to get the prostate cancer. And also in the digital examination is very important by a urologist. This can be included in the master health checkup also. If these things are done, we can diagnose prostate very, very early and treat it completely and cure it. Research has shown that the death from the prostate cancer has reduced by 30% because the PSA screening. Previously, this equipment, this product was not available with us. People did not know that PSA can be screened and found out. So the death in prostate cancer was very, very high. Whereas after PSA screening, we diagnose the prostate very early and treat them so that they get better. And the death rate from the prostate cancer is reduced by 30%, which is a very good news. Early diagnosis will help the patient cancer before it becomes a life-threatening disease. So anybody who is 55 years or 69 years old should make individual discussions about doing a PSA to the doctor and get it done periodically. Then we can avoid getting death from cancer prostate. Thank you. But I am also happy to answer any questions if they have.
Thank you so much, Doctor, for the wonderful information which you have shared about the prostate and how to overcome that and the solution of the treatment procedure, everything. So, delegates, if you have any queries, please put it in the chat box so that the doctor can answer you. Okay. There is a question. Is irritation during urination due to prostate enlargement? Can you explain what is PSA screening test, sir?
Irritation during micturition for a male member can be due to the prostate enlargement, also urinary tract infection. Normally, urinary tract infection do not come to male members unless there is some structural abnormality like prostatic hypertrophy or some other problem in the urethra. So, whenever there is irritation, first step is to do a urine examination, urine culture, and then find out whether there is any infection. If there is no infection, still the irritation persists, then you have to do the ultrasound of the kidney, ureter, bladder, and also check for renal function tests like urea, creatinine, and also at the same time check for PSA if the patient is above the age of 45 years. Then we can find out whether it is due to prostate benign or malignancy, and then treat accordingly. Any other question?
Yes, the next question is, symptoms of prostate cancer, doctor. Prostate cancer, symptoms.
See, early stages of prostate cancer will not give you any symptoms. The main symptoms will be only like benign prostatic hypertrophy. There is no specific symptoms for cancer prostate. Any prostatic enlargement will give you frequency, urgency, painful ulceration, and then urge incontinence, and the flow reduction, and blood in the urine. All those things can come in any prostatic hypertrophy. But particularly for cancer, only advanced cancer prostate will give you pain in the body, like spreading in the whole body with bone pain, everything. But normal prostatic hypertrophy symptoms only is good enough for the cancer prostate. So any prostatic symptom, we have to investigate and exclude cancer at the same time.
Next question. Can enlarged prostate also cause frequent symptoms of apparent constipation?
No, normally not. Unless it is a very large enlargement obstructing the rectal wall, which is very, very unusual. This constipation does not correlate with prostatic hypertrophy.
Thank you, sir. Next question. How to reduce enlarged prostate? If the size is minimal, that is due to age factor, is any physical activity suggested?
No, with the prostatic hypertrophy is there are medicines. I don't think any physical activity will reduce the prostatic size. In allopathic medicines, we do not know. But medicines are there to reduce the size, as I told you and showed you in the video also. Dutasteroid and finasteride medicines are 5-alpha reductase. That drugs can reduce the hyperplasia of the prostate. And the alpha blockers will enlarge the urethra so that the urine can pass. These are the two drugs which is totally used for prostate in modern medicine.
Thank you, sir. Next question. What are the side effects of the medicines?
It's a good question. Normally, side effects are not many. The minimal side effects will be in alpha blocker, there will be some reduction in the blood pressure of the patient. So there can be postural hypotension. Suppose the patient gets up from the bed, directly stands up, he will feel a momentary giddiness for his, as if the head is rotating. That is a side effect in alpha blocker. So what we suggest to them was, first few days they have to get up from the bed, sit in the bed, then only stand up. So this is the thing which is one side effect. Another side effect is, there is mildly, if you have a dutasteroid and alpha blocker combination, there is a reduction in libido for the patient. Male members who are 50s who are still active in sexual life, they will have a reduction in the libido, as well as the ejaculation. The semen will not come out through the urethra because the alpha blocker drugs relaxes the bladder neck. When the semen ejaculates, it goes into the bladder and it comes in the next urine. So he will have the enjoyment, but he will not ejaculate. So they cannot get children. So above 55, if they are planning for any child, they should not take these medicines.
Next question. I understand medicines are to be taken lifelong. If it is BPH, why not operate?
Medicines are prescribed to take not for lifelong. For long life only we are giving the medicines. And if you want to operate anytime during the course of the medicine, we can operate, we can stop the medicines. There's no problem at all.
Please suggest exercises and habits to prevent prostate problems in old age.
Particularly for prostatic hypertrophy, there is no exercise. General exercise, reduction in body weight, cholesterol, all those things are very important. And do not postpone urination. Always go to the toilet when it is necessary. And then avoid drinking coffee and tea much because it produces frequent urination. And avoid taking fluid after 7 o'clock or 8 o'clock so that you can avoid having night nocturia and disturbance of your sleep. And also animal proteins, they say, in large amounts may increase the growth of the prostate. So to avoid animal proteins in the large amount, and I'm not saying that you should completely become vegetarian, but avoid generally animal protein to a minimum.
Next question. My PSA level is below 1. For the last 14 years, I'm taking Thompson and Dutastride. Can I continue this tablet?
PSA level 1 is very good. That means there is the chance of cancer are very, very low. And this tamsulosin and dutasteride are given for prostatic hypertrophy symptoms. It depends on your symptom and also the size of the prostate and also the speed of the urine flow and the amount of residual urine after you pass urine. So these are all the criteria which decides whether you continue or not the PSA amount.
Next question. I do not have frequent urination, but when I get feeling of urination, I could not control. Is it the symptom of prostate problem?
Yes, this is one of the symptoms of prostate problem because it is urgency due to the prostatic hypertrophy. The gland enlarges into the bladder and makes the bladder feel that there is a urine and it has to come out urgently. This is usually a problem of prostatic hypertrophy. So if you investigate further, you can find out whether the prostate is enlarged and the residual is there, another thing. Apart from this, urinary infection also can cause this. So you have to test the urine also for infection.
Thank you so much, sir. Is there any questions? People, doctor is there to answer you. Please put it in the chat box if you have any queries. And there is a small question like, not able to see the earlier part of the talk. Will you put it this video on YouTube? Yeah, we certainly would share the link to all the delegates. Next question has come, sir. Does low level of PSA guarantees cancer-free?
Mostly yes, but that is not a foolproof method. It is only a indication that it may not have a cancer. High level of PSA also may not indicate cancer at the same time because infection in the prostatitis can also cause high level of PSA. That's what I'm saying. The rectal examination, PSA correlation, both are necessary for diagnosing the suspecting CA prostate. For diagnosing it, we have to do MP-MRI and then biopsy. That only will 100% tell you it is no prostate cancer. So these cancers, prostate, can be suspected if the PSA is high. Normal PSA having cancer per se is very rare, but it is possible, but you cannot completely exclude. So rectal examination is also a must because it should be combined. Both the things should be combined and the decision should be taken.
Next question, sir. Is PSA done in blood enough or PSA screening test required?
No, PSA screening is only blood test. That's all we do.
Okay. Any relation between sexual activity and prostate?
This has been widely discussed abroad also, and there is a lot of debates going on. Sexual activity between the age of 40 and 50, number of ejaculations more than 3 times a week can reduce the prostatic hypertrophy. That's what they have found in Australian research papers. And they went to the extent of having ejaculatory clinics in Australia where above the age of 40 years, they have places where they can ejaculate with masturbation. But masturbation or sexual life above 45, more than 3 to 4 ejaculations per week have known to reduce the prostatic hypertrophy and also cancer prostate. This is not a completely validated statement, but there are original, research papers coming in this direction. So ejaculation at best is not bad for health. It is very good for prostatic health.
Can we take medicines continuously to get rid of prostate problem?
Yes, prostate problem, it is almost like lifelong medicines. There's nothing wrong in taking, but periodically we should check your prostate size, residual urine, then find out whether you can alter the medications or reduce the medications. Suppose if the prostate size is getting smaller, then you can stop the dutasteride and take only the alpha blocker. There are two aspects, two combinations. One drug can be reduced according to the size of the prostate. The size is becoming less than 20, then you don't need to take the dutasteride, only you take the alpha blocker.
When is the surgery advised depending on the condition?
Totally depends on the person. There are indications for surgery which is very clear. One is patient not able to take the medicine continuously and he doesn't tolerate the medicine. Number 2 is there is recurrent blood in the urine, recurrent urinary tract infection, and patient has retention of urine, not able to pass urine, requiring a catheter, and the catheterization and again removed the catheter, the patient is not able to pass urine after medications. That is the indication. Recurrent retention, recurrent urinary tract infection, and hematuria, blood in the urine, intolerability to the medications, and the last but not least, the kidney failure. If it affects the kidneys, you have to operate on the prostate.
Does this surgery depend on the size of the prostate, doctor?
No, this indication doesn't depend on the size. It only depends on the symptom and the residual urine and the other complication as I stated to you.
Any other questions? Thank you. Fine. Thank you, Lisa. Thank you so
very much.
So I think let's come to the end of the session. Thanks, Doctor, for patiently answering all the queries. And before concluding the session, I would just like to make a small announcement. So on this occasion, as I said, the September month is Prostate Cancer Awareness Month. So to celebrate that, like CuriHospita is holding a free consultation by our experts, urologists, on Saturday, that is 4th September between 3 to 5 p.m. So we would certainly share the address in the chat box. So you can all make a note of it. CuriHospita located in OMR Tharipakam, and it is exactly near the BSR mall. So you can look into the website www.curi.co.in to know more about us. Thank you so much. So I would just, before ending the session, I would just like to deliver the vote of thanks. So it gives me an immense pleasure to deliver the vote of thanks for this event. First of all, I would like to thank the speaker of the day, Dr.P.B.Sivaraman, for spending his valuable time, sharing his valuable thoughts on prostate health. On behalf of CuriHospita, I would also like to thank Dr. V.S. Natarajan, founder of Dr. V.S. Natarajan Geriatric Foundation, that is India's first medico-social foundation exclusively for elder care, inaugurated in the year 2017, for providing such a platform to meet the purpose of creating awareness. I also thank Mr. Rishikesh and Mr. Anand for being our digital partner. I thank you from the bottom of my heart. Also, I want to express my heartfelt gratitude for the guest presence today. So I thank the entire team for making this event a success. Thank you so much, delegates.
Thank you.
Thank you, Dr. Sir. Thanks for being always very supportive to us. So I'm just right now tapping the address of CuriHospita. So if anybody would like to visit our hospital, like you can, you're most welcome. And we are having a free consultation on Saturday. I'll mention the timings as well in this chat box. Please make a note and utilize these opportunities and get to know your prostate health.
Madam, what is the landmark to reach your hospital?
So I think only few participants are there. So kindly make a note. I put it in the chat box that we have a free urology consultation on Saturday, 4th September between 3 p.m. and 5 p.m. So Sangalam, Saturday Sangalam, Sanikkarama, 3 மணிலேருந்து 5 மணி வரைக்கும் டாக்டர்ஸ் கன்சல்ட் பண்ணுவாங்க. ஸோ உங்களுக்கு யாராவது உங்க ஃப்ரெண்ட்ஸ், ரிலேட்டிவ்ஸ், whoever it is, யாரா இருந்தாலுமே வந்து அவங்க ஆப்பர்ச்சுனிட்டி யூட்டிலைஸ் பண்ணிக்கலாம். டாக்டரை வந்து கன்சல்ட் பண்ணிக்கலாம் அவங்க டவுட்ஸ்க்கு எதுவா இருந்தாலும். நாங்க கியூரி ஹாஸ்பிட்டல் வந்து OMR துறைப்பாக்கத்துல லொகேட் ஆயிருக்கு. ஸோ அட்ரஸ் வந்து பாக்குறதுக்கு உங்களுக்கு வெப்சைட்ல போனீங்கன்னா அட்ரஸ் தெரியும். நானும் சாட் பாக்ஸ்ல டைப் பண்ணிருக்கேன். ஸோ ப்ளீஸ் மேக் அ நோட் ஆஃப் இட். Sir, landmark வந்து துறைப்பாக்கம் பெருங்குடி டோல்கேட் தாண்டின பிறகு வரும். If you can share me your number, I can send the location through WhatsApp or உங்களுக்கு மெசேஜ் பண்ணி விட முடியும்.
Okay.
Okay, let's end the session now. I'm leaving the meeting. Thank you so much once again. Thank you all for sparing the time and gaining the knowledge on the prostate health. Thank you so much.